So welcome today. This is a video about a composite filling on an upper right 2, and what's different about this is we're going to use a Palodent sectional matrix to create the form of the tooth. So the first thing we obviously have to do, we have to use rubber dam with composite, I'm afraid. And in this case, I've decided to isolate the teeth 4 to 4. So I could have just isolated the one upper right 2. What I've noticed though with these butterfly clamps that they use, that they can kind of get in the way when you're using a drill. So you could say, oh well I'll isolate 2 to 2 or 3 to 3. I always feel like to isolate 3 to 3, you need to use the butterfly clamps, and they're just massive, and I don't really like using brinker clamps. So here we're using it 4 to 4. The next thing we need to use here is obviously a floss tie, okay, because when you are isolating multiple teeth, sometimes it doesn't tuck nicely into the tooth. And have you noticed with this floss tie here, what you need to do is just get a little bit of a flat plastic and just push it behind it and then tighten the floss tie a little bit more. And what that does is it tucks it more into the gingival crevice, as you can see here. Really, really nice and tucked in. To remove the filling, I'm going to use my preference, and that is a pear-shaped burr. Some people don't like pear-shaped burrs, some people do. I don't know why I like it, I just do. I think it was just something I was taught at university to use. And what I'm doing here, I've been very, very, very careful. I'm just very judiciously removing the old worn-out filling and not the underlying enamel or dentin. Another thing that you might notice as well is I am not drilling from the margin, from the sort of distal aspect of this tooth inwards. What I'm doing is I am drilling out the palatal side of it, and what I'm trying to do is I'm trying to undermine the whole filling itself. Because what you'll see in a minute is I will not use the drill to remove the distal portion of this tooth. I am going to undermine the bond of it and then get a little instrument and just poke it out. And the advantage of this is obviously you're not using a drill close to another tooth, and you could damage it. And here I am using a small instrument just to flick the remaining undermined filling out. Perfect. Like I say, no decay with this tooth. It was just a broken, fractured filling. There's a little bit of staining there, so I'm just going to very, very carefully use the pear-shaped burr there just to give it a little bit of a clean out. And I'm also going to bevel some of the margins on the cavity as well. So now we're doing selective etching. Some people like to etch the whole cavity. Some people like to etch a little bit, just the enamel first, and then get a brush and give the dentin a little bit of a clean out with the etch. When you do wash the etch away, the nurse really needs to make sure it's nice and dry all the way around the tooth, and the dam. Make a really nice, clean working field for the filling. So this is the trick we're going to use today. We're going to use a Palodent sectional matrix to create a really, really nice emergence profile for the filling, and we need this because the filling or the cavity is very, very close to the gum line. So what I'm using here is a medium-sized Palodent sectional matrix with a wedge, and as you can see, it gets a really, really nice sort of curved line, and it tucks nicely in. So using a little bit of bond here. I don't know what bond I'm using. Sorry for that. And I like to really, really massage it in, and then use a 3-in-1 tip just to dry the area really, really nicely, very, very gently. a like cure. You'll notice throughout this video that the like cure doesn't last very long. I've just edited the video just so it's more watchable. Here, I'm a big believer of flow. I love a bit of flow, especially on the base of the cavity. Again, you just got to be careful you don't use too much of it because it can affect the strength of the filling, but it's always nice to get it in all those little nooks and crannies. And now I'm using Venus Pearl composite. I believe it's A2. And what I'm doing is I'm just pushing a big globule of it into the cavity, and then I'm going to use something called signum, which is like it's like a manipulating solution where you can put a little bit on your instruments, and then you can manipulate the composite without it sticking to the instrument. So essentially I'm just going to fill the cavity with the composite, and then I am just going to carve it, essentially, you know, remove the excess like I'm doing here, and just take my time. I'm using a scope at the moment, and on the scope is a yellow light filter, and essentially what that does is it allows me to adjust the filling without it setting. Just gently carving it, taking my time. Sometimes I use too much signum, and it becomes like too liquidy, and it's difficult then to manipulate the composite. So if I have used too much signum, what I'll do is I'll very, very gently air dry the area, and that makes it a bit better. And as you can see here now, I'm using the sectional matrix as a guide to create a nice margin for the filling. You know, just take your time. Take your time. Like you. So at this point, I'm happy with the filling that I've carved. I'm going to remove the wedge. I'm going to remove the sectional matrix, and it's always a good sign when you can't quite push it off, because you know you've got a nice good contact point. And overall, it's a nice result, but it's still a bit unpolished. And also there's a little bit of flash of composite and also bond around where the matrix had been, and that obviously would be a plaque trap, and also the patient would see that and feel that with their tongue, so that needs to be removed. Again, everyone's got a preference. I really like these white stone burrs. They polish, but also they just take away a little bit, and you know, it's a little bit more careful when using these white stones over a normal diamond. And then we remove the floss tie. At this point, when I'm removing the floss tie and I'm removing the rubber dam, I'm going to warn the patient before we take the dam off. I'm going to warn them that there's going to be a bit of tugging, a bit of pushing, and there's going to be a big pop when I push this rubber dam off. So it isn't a nasty surprise for them. Once the rubber dam's off, a bit more polishing, and I'm going to ask the patient to bring their teeth together and tell me if they feel like they're biting high onto the tooth or not. Another thing I like to say is, you know, are your teeth touching like they were before? That's a really good way of sort of vocalizing, you know, what you need. Is it high in the occlusion? And as you can see here, it's quite nice. Thanks for watching, and I'll see you soon.